The last question that we'll entertain here today relates to depression in dogs. Does it occur, and how can you recognize the signs of depression in a dog?
Yes, this is a great question, and actually it's a topic of debate among behavior specialists. I do think that dogs become depressed. I do think dogs suffer depression, and I'm making a distinction there. We are better at recognizing reactive depression in dogs. In other words, their family member dies, someone in the household dies, they lose a companion. They're depressed as a result of the loss. They lose a leg to cancer. They're depressed as a result of their illness. So we're very good at recognizing that. Well, I should say behavior specialists are very good at recognizing that. And I'm making the distinction because, unfortunately, we don't teach most vets to look for these things. But I have diagnostic criteria for both reactive and endogenous depression. In other words, depression that's not due to something tragically happening. And I think we do see it in dogs. I think there are unhappy dogs, and it can't be traced back to other things. I think they're rare, or at least they're rare in my patient population, and we really have no idea of the number of these dogs because the types of studies that need to be done have never been funded and done. So there's a lot to do in this field. But when dogs begin to withdraw, when they sleep more, when they're not interested in eating and they used to like to eat, when they're not interested in treats and they used to like the treats, when they used to like to go for walks and they don't want to go for walks and they're not painful anymore, when they used to love to play and they don't play anymore, when they used to play with toys or they wanted to go to the park to see their friends or they loved it when you had company and now they see the people, maybe they look at them, maybe they wag their tail and they go lie down, and there's no underlying physical cause, I think we need to consider this.